So right now at the White House, President Donald Trump announced a slim down in the prices you pay for weight loss drugs. So how does the president say he'll do it? Through partnerships with drug company Eli Lilly and Novo Nordisk. Now, for the most eligible, and think about this, the cost could be just under $250 a month. Compare and contrast that to this. Right now, people who use those same drugs pay around $1,500 a month, give or take a couple $100 on either side of that number. Health and Human Services Secretary Robert F. Kennedy Jr. was at that announcement. He says this deal is going to have the biggest impact on you at home, the American people. Listen.
It is the #1 cost of all drugs. This is the biggest drug in our country. That's why this is the most important of all the MFN announcements we've made. This is going to have the biggest impact on the American people. All Americans, even those who are not on Medicaid and Medicare, are going to be able to get the same price for their drugs, for their GLP drugs.
All right, so let's bring in family medicine physician and founder of Beyond Clinical Walls, Dr. Bayo Curry-Winchell. Doctor, nice to have you with us today. What do you make of this announcement?
This announcement is really instrumental for people to be able to access a drug that is over 12% of Americans right now are accessing GLP drugs. So to have this medication to be able to lose weight, it's phenomenal.
Well, we know that ahead of those Oval Office remarks, we learned that Eli Lilly, major drug maker there, made the decision to move its obesity drugs to what's called late-stage trials. After it showed some promise, you watch the trials as they come in and get published in medical journals. They say it's helped patients lose as much as, 20.1% of their weight in mid-age studies. Walk us through what kind of processed drugs like this go through before they hit the shelves.
So there's a lot of things that have to happen before a patient actually has access to a GLP. We want to make sure that it's going to be safe. We also want to be mindful of what side effects could happen, so therefore we can respond to it. So it can take years for a medication like this with a GLP-1 to actually come to market and for people to actually use it.
So how many people currently use these in the United States? Because I'm also very aware of the drumbeat of people who are now signing up for Obamacare or open enrollment, that the price of their health insurance has just gone through the roof. Jaw-dropping for many families who are already suffering economically. And these drugs, in part, are to blame for those sky-high prices. How many people are we talking here? Because that helps us to sort of do the math in a backwards sense.
Yes. Well, a study showed from 2018, over 8 million prescriptions have been used for GLP-1s. So that averages out to about over 12% Americans have already been using GLP-1s.
Okay. Well, that's a lot of Americans there.
Yes.
Thank you so much, Doctor. We wish you a good day.